So welcome back. I hope everybody had a great lunch. And it was really nice to see all of the interactions happening between the patients and the researchers. That's one really nice, unique event aspect of this event. And welcome back to everyone on live stream. We're very glad to have you here. Right before we start, for the people who are here, there's a very uniquely folded $20 bill that was found. So if you can describe to me the way in which it was folded, then it's yours. Keep trying. Acute angles, that's good. Okay, so we're ready to get started with our afternoon session. Thank you all again for your engagement in the morning session and all of those wonderful questions. We have opened up the question portal again at the URL that was on here before, omf.ngo/questions. So I'm happy to welcome our next speaker up, Ron Tompkins from Harvard and MGH, a member of the OMF Scientific Advisory Board and a close collaborator of Ron's for many years.
Well, I've worked with Ron, I guess actually a couple of decades now, and it's been really great. Now, don't be fooled by his dress as a physician. He's actually a geek. Because he came from MIT, and that's a requirement to get out. Anyway, he's worked a lot on trauma, and a big trauma study we did with him, and there's a lot of similarities between what happens in trauma and sepsis and huge immune reactions and so forth. That the hope is that we would maybe learn something from that, because there's a very massive database of that kind of data, and maybe we can use it to understand, because a lot of times the body reacts very similarly with different types of insults. Anyway, it's a great pleasure to have him here, and he's going to run the other center on the other coast, the Stanford of the East.
Stanford. Yeah. Thank you very much, Ron. We've known each other and worked very productively for, I guess, 2 decades now. He was very kind to add so much in the way of genomics and computation to our studies, and such that I'm eternally grateful for our relationship. I'm totally new to this field, and I just want to say that I have been welcomed by the investigators and also the community and their caretakers, and I would hope to add something meaningful to your struggle with this disease. I'm embarrassed as a doctor. Part of me is a doctor, and part of me is an MIT chemical engineer. But my doctor side is very embarrassed by the way that my community generally responds to a disease they do not understand, and for which understanding what treatments might be useful is really hard. And so many of the doctors these days are simply going by protocols, and if you don't meet that protocol, for which there is none, it seems to me, in ME, that you can't possibly have a disease. And I just find that ridiculous. So our group has spent a very long time understanding the human response to an injury that was serious enough to kill you, a 20% mortality rate. And as Ron mentioned, there are a great deal of findings that are in spades in the human response to such an injury that to a lesser degree are also shared in the disease of ME. And we know a great deal about the inflammation, immunity, and metabolism. And I would hope to be able to add some of those insights to better understand those abnormal features in ME. And so that's my reason for being here. I learned a lot being on the Scientific Advisory Board of Open Medicine Foundation. And as we were going along, the Harvard of the West, I like to think. We have had such a productive relationship over such a long period that we would be able to rejuvenate that and continue that in the field of ME. And that's certainly our intent. So Harvard cares a great deal about its name, and so using it loosely is a very touchy subject. So what we call this center, it is a compromise right at the moment, but it's MECFS, Collaborative Research Center at Harvard. Now what it is they're a group of clinicians at Harvard who have contributed and continue to contribute substantially in the field of ME, and I'll point them out. But also, there are superb investigators with unique resources that could easily be recruited and are willing to be recruited into highly resolved studies in the field of ME. And we have 12 investigators from Mass General. We have a true expert in the field of sleep, Dr. Mulligan, and at the Beth Israel, and we have 2 investigators, David Systrom, and a name that should be well known here is Tony Komarov. And all of them are enthusiastically interested in our common initiative at this point, and hopefully is a well-funded center sometime in the very near future. We also, because it's very important to have proper controls, we have close collaborators also at the University of Birmingham. Janet Lord is chair of the Department of Immunology there. She's very interested in innate immunity that plays a real role in ME, and she's quite interested. She's head of a center for aging and inflammation, and 2 close colleagues at the University of Nottingham who are excellent physiologists and classical physiologists studying metabolism, are very enthusiastically interested in participation. There's been great progress in the UK. I think part of a very long discussion at Parliament in early summer, in June, has had an impact on the MRC. The MRC has put out an announcement for a request for proposals, and we're going to engage and participate in that request, and I think that would be wonderful. Studying normals seems to be more straightforward. I don't know what it is like in California, but I can tell you studying normals in any kind of invasive way at Harvard is just not going to happen. But in the UK, it seems to be a little bit more straightforward. They are superb scientists, and I'm delighted to be working with them on that, and that's a very important control. And lastly, a group that is, in my opinion, the very best high-throughput proteomics people in the entire world, for that matter, are very interested to participate with us. We have also, Ron and I have worked with them for almost the whole time, and they have been absolutely superb. They're interested in fatigue and muscle metabolism, and we are just delighted to have them join us. So we're beginning here. So how does this advance? Oh, I'm sorry. Your first question might be, what do we intend to do? And it's a staged process. And our intent at the moment is to conduct clinical science mechanistic studies with a very high priority. Now, a lot of this depends on the staging of funding. These things are gated by that. Our initial research focused to discover, and particularly the recovery mechanisms that occur in ME that is in some fashion dysregulated, creating this post-exertional malaise syndrome. And by deeply analyzing what is happening in muscle biopsies in a way that never has ever been done in any way close in the past, we think has some likelihood. Another area where we offer some real unique expertise is in neuroimaging. There are many technologies that have been developed in Martino Center and other MRI, magnetic resonance, and MRI and PET have come from Mass General. And there are very unique opportunities for neuroimaging. And we've recruited quite a number of individuals there who are willing and interested and actually currently conducting research along these lines. And we just feel that well-characterized patients studied in the very best way possible can add new information for our field and help us at least to come closer to a biomarker with our intent, ultimately, new therapies. And that's really our intent. As funding proceeds, we would love to develop a clinical trials network for multi-center clinical trials. And that would be, MGH does that very often, and we would be delighted. But those are very expensive endeavors, but that was also one of our intent. Our real interest is developing new therapeutics for this field, and we would hope that we would be able to do that. Thank you very much.